I did was What About Bob? And the main character in this movie was Bob, and Bob had anxiety disorder and OCD. OCD is compulsive, obsessive compulsion disorder, and GAD, or generalized anxiety disorder, which means he worries about everything, and he also has panic disorder, and this means he fears everything bad will happen, even if he doesn't have to worry about it. And anxiety disorders are among the most common mental illness in America, and over 21% of adults, 42.5 million, are affected by these illnesses each year. And Bob met the criteria for being abnormal because he was always anxious about where he went when he left his apartment, and he had a hard time actually opening the door and leaving his apartment. And when he did, he had a hard time going into crowded places like elevators. In the movie, when he had to go see a psychiatrist, and he always had tissues in his pocket, so he could have them on his hand, so he could grab the doorknobs and everything. And some symptoms of panic disorder or GAD are he exaggerated and worried about everyday life. It's hard to concentrate and finish daily tasks, and you are exhausted and worry all the time, and you have headaches, tension, or nausea. Or you can have panic attacks and sudden feelings of terror, sometimes repeatedly and without warning, and these can often be mistaken for heart attacks. And some physical symptoms include like chest pain, palpitations, dizziness, shortness of breath, and stomach upset. And people with this type of disorder try to avoid other people, and they isolate themselves. And some casual factors for the character's disorder were the types of treatment he received, and these were medications that he had to take each day were specific ones. And he also had a psychiatrist who was Dr. Leo Marvin. And the ways this order impacted Bob and others in the movie was Bob's psychiatrist, Dr. Leo Marvin, was an accident, technically, because he wasn't actually supposed to be a psychiatrist for Bob. He was going on vacation the next week. But the old psychiatrist of Bob was tired of him and he quit his job so he didn't have to deal with Bob anymore. And in the end of the movie, Bob actually drives Leo insane, and Leo Marvin has to go to an insane asylum. But before that, Leo gives Bob his new book that he just authorized, and it is called Baby Steps. And Leo made this book to give to his patients so that it could help them with their disorders and help them in everyday life. And the impact that this had on Bob was when he took the book, Bob actually started whispering to himself baby steps, and he would take really small steps. And the book actually didn't really help Bob any because Bob ended up going and following Dr. Leo to his vacation home and finding him there. And the way this disorder was portrayed by Bob was very well, and it showed what it would be like for that person with that disorder and what they have to go through every day. And it even went as far as to show us what that person would do to try and help themselves get better. And after my opinion after watching this movie is I feel like it would be terrible to have this disorder, having to have all those anxiety and like worrying about everything, and even like having to deal with not wanting to touch public places like doorknobs or that. And my overall reaction to this movie and how the disorder was portrayed by Bill Murray, who played as Bob, was I actually thought the movie was pretty funny, some parts of it, and it was also very serious and showed us what this disorder did to people and how it affected them. And some additional resources were from the internet I found about anxiety disorder is people anticipate their everyday life activities even if there's no reason to, and they have physical symptoms like they have fatigue, trembling muscle tension, headaches, or nausea with chest pain, or they can have panic attacks or feelings of terror. And they can be shortness of breath, they can be dizzy, and they can abdominal discomfort or unreality fear of dying, like Bob did. He feared one of Bob's fears was that his bladder would burst. And some more they have with some more things people with anxiety disorder have, or at least mental and physical conditions like depression or substance misuse or trouble sleeping and digestive bowel problems. Or like Bob did, he kind of isolated himself. He didn't really talk to anybody else. And sometimes they can commit suicide or think about it. And that is pretty much all about the movie. What about Bob?